Welcome to Miltenyi's 2019 Open Enrollment. This is your annual opportunity to review your benefit options and make changes if needed. During this presentation, we will review the open enrollment details, provide an overview of your benefit programs, and talk you through the next steps for enrollment. In the upcoming weeks, your benefits should become a big priority. That's because open enrollment only happens one time a year. During this year's open enrollment period, no action is required unless you would like to make changes to your current elections and/or enroll in flexible spending accounts, FSA, for the 2019 plan year. Open enrollment officially starts on Monday, November 5th, and will end on Sunday, November 25th. During open enrollment, you can review your current elections and make any desired changes within UltiPro. All elections will become effective January 1st, 2019. Your elected benefits will remain in place for the 2019 calendar year. You will not be able to enroll or change elections until the following year's open enrollment unless you experience a qualifying life event. Qualifying life events include adoption or birth of a child, marriage or divorce, or a change in employment status of you or your spouse. If you do experience a qualified life event change, you need to request updates to your elections within 30 days of the event. We have good news for 2019. Miltenyi will not be making any changes to our carriers or planned benefits for the year ahead. In addition, we are excited to announce that our generous cost share for employee coverage will be maintained, and we are also improving the company subsidy for dependent coverage by paying an additional 10% of dependent premium cost. This slide reviews your 2019 monthly contributions that will go into effect January 1st. Contributions are deducted on a pre-tax basis. Because we were able to keep our overall costs with each carrier similar to last year, the employee contribution adjustments for 2019 are between $1 to $2 per month. If you enroll your dependents, you will see a decrease in your costs for 2019 based on Miltenyi's decision to reduce your percentage of cost share. If you are enrolling a domestic partner, deductions for their portion of premium will be post-tax and imputed income will apply. Please contact Human Resources for details or questions on domestic partner coverage. Let's take a closer look at our 2019 benefit program. Kaiser HMO is available to Miltenyi employees located in California. When you enroll in Kaiser, you must access all of your care through Kaiser providers and facilities. The Kaiser plan covers office visits at a $20 copay. Inpatient hospitalization is covered at $100 per admission. If you are traveling and not near a Kaiser hospital during a medical emergency, you would still have access to emergency care at the nearest hospital. The copay for emergency visits is $100. Kaiser also has their own pharmacies for prescription drug coverage at $10 copay for generics and $25 copay for brand name drugs. Once your expenses reach the out-of-pocket maximums of $1,500 in the calendar year, you are no longer responsible for sharing in the cost of covered services, and the plan will pay 100%. The Blue Shield PPO plan allows you to utilize both in-network and non-network providers. When you stay within Blue Shield's network, your costs will be lower as the providers cannot bill you beyond the set fee that Blue Shield has negotiated. For in-network office visits, you pay a $15 copay and no deductible will apply. Prescription drugs costs will vary based on the assigned tier as listed on this slide. Generic drugs are typically a $10 copay. If you need to use the plan for more complex services such as lab, x-ray, surgery, or hospitalization, the deductible and coinsurance will apply. The individual annual deductible for this plan is $250 in-network, and coinsurance is 10%. Once your individual expenses reach the out-of-pocket maximums of $2,750 in the calendar year, you are no longer responsible for sharing in the cost of covered services, and the plan will pay 100%. The out-of-pocket maximums listed on this slide include copays, deductible, and coinsurance. Each year, Blue Shield makes mandatory changes to their benefit plans. Changes for 2019 are highlighted in red. For full details on your plan benefits, please review the detailed plan summary. Miltenyi also offers employees a high-deductible health plan, HDHP, With HSA, Health Savings Account. For 2019, Miltenyi will continue to fund the HSA plan with $1,500 per calendar year. The HDHP plan uses the same network of contracted providers as the PPO plan. Under this plan, you will pay the full cost of services, including office visits and prescription drugs, until you meet your annual deductible as listed on this slide. Once the deductible is met, you will be charged 20% coinsurance in-network until you have reached the calendar year out-of-pocket maximum. If you do reach this limit, the plan will cover you at 100% for any covered services. Each year, Blue Shield makes mandatory changes to their benefit plans. Changes for 2019 are highlighted in red. For full details on your plan benefits, please review the detailed plan summary. While the HDHP plan has a larger deductible than the PPO, it is important to consider your overall expenses after taking into account the lower contributions and Miltenyi's $1,500 HSA funding that comes with enrollment on the HDHP plan. This chart illustrates how your year-end out-of-pocket expenses on the HDHP plan could be less, even if you are paying for the full cost of medical services, including office visits and prescription drug costs totaling more than $1,000. It is also important to remember that both the PPO and HDHP plan protect you by paying 100% after annual out-of-pockets are met. If the high-deductible health plan with Health Savings Account has your interest, you want to make sure you are eligible to participate. If you enroll on this plan, the Health Savings Account will be your personal bank account. This account allows you to set aside tax-advantaged dollars for healthcare services and qualified medical expenses. To be eligible for an HSA, you must be enrolled in Miltenyi's high-deductible health plan. You also cannot be enrolled in any other healthcare plan, which would include a spouse's medical plan or healthcare flexible spending account, FSA, through his or her employer. You also cannot be claimed as a dependent on someone else's tax return. For 2019, Miltenyi will continue to fund $1,500 per year for employees who enroll in the HDHP plan. These amounts are prorated monthly. You can also make employee contributions via payroll in addition to Miltenyi's funding. As illustrated here, you can contribute an additional $2,000 for single coverage and $5,500 for family coverage on a pre-tax basis for each calendar year. Again, these amounts are prorated if you are not enrolled in the HSA eligible plan for the full year. Once your HSA account is established, you can make pre-tax contributions at any time throughout the calendar year. You have the ability to set up payroll deductions through Miltenyi or make lump sum deposits which you can claim as deductions on your year-end tax filing. Any interest earned in your account is tax-free, and any distributions or reimbursements claimed for qualified expenses are also tax-free. If you want to learn more about the advantages of Health Savings Account, please visit www.healthequity.com. HSA qualified expenses are not limited to medical. You can seek reimbursement from your HSA for medical, dental, and vision expenses. Here is a list of eligible items. Again, it is important to remember that if you are participating in an HSA plan, you cannot be enrolled in a standard healthcare FSA with Miltenyi or a spouse's employer. You are eligible to participate in a limited FSA, which reimburses dental and vision expenses only. Standard is the carrier for our dental PPO plan. Our plan covers you in or out of network and provides a calendar year maximum of $2,000 per year per enrolled family member. Preventive care is covered at 100%. If your provider is in network, you cannot be balance bill for amounts that exceed the negotiated contract rate. When you go out of network, you have slightly lower levels of coverage, and your provider may balance bill you if they charge more than what standard considers usual, reasonable, and customary. Our plan covers adult and children orthodontia at 50% up to a lifetime maximum of $2,000. Our dental plan also includes a valuable feature called the Max Builder that allows you to carry over $400 of unused maximum dollars into the next plan year. In order to be eligible for this carryover, you must incur at least one dental claim in the current year, yet not incur more than $750 in dental expenses. VSP is Miltenyi's carrier for vision coverage. VSP is the most commonly used vision network nationwide. It is easy to find a contracted provider to schedule your eye exam, which is covered once every calendar year at a $10 copay. If you need materials, you will pay another $25 copay, which will cover your lenses and a frame allowance of up to $130. If you prefer contacts in lieu of glasses, you are covered for the same allowance of $130 once every 24 months. Non-network benefits are available, but you will receive the best value and level of coverage when using a contracted provider. Miltenyi provides basic life and AD&D benefit of 1 times your salary to a maximum of $300,000. This coverage is 100% funded by Miltenyi and insured by Standard Insurance. Please note that the IRS requires you to pay a tax for the value of group life insurance benefits for amounts exceeding $50,000. This imputed income amount, if applicable, is reflected on your paycheck. You are also eligible to purchase additional voluntary coverage, which is subject to evidence of insurability. Open enrollment is also a good time to review your listed beneficiaries to ensure that they are up to date. Disability is an important benefit that provides salary continuation in the event that you experience a short or long-term disability. Your short and long-term disability insurance coverage is 100% funded by Miltenyi and insured by Standard Insurance. For short-term disability, you are covered after 7 days and will receive a benefit of 60% of salary up to $2,300 per week. If your disability continues for longer than 90 days, you will be eligible to continue benefits under long-term disability, which provides a benefit of 60% salary up to $10,000 a month. In the event you become totally disabled and cannot return to work, the long-term disability benefit will cover you until your normal retirement age. Our flexible spending account and commuter benefits are administered by Navia Benefits. The annual maximums are listed on this slide. If you are enrolled in an HSA plan, you nor your spouse should be enrolled in a standard healthcare FSA plan. You can participate in a limited FSA plan, which allows you to set aside pre-tax dollars for dental and vision expenses only. Healthcare and limited FSA limits are likely to increase to $2,700 for the 2019 plan year. This is currently pending confirmation from the IRS. The FSA plans allows you to set aside money on a pre-tax basis for reimbursement on eligible out-of-pocket expenses you incur in the calendar year. Our plan does allow for you to carry forward up to $500 of unused healthcare dollars into the following plan year if you have a positive balance once the submission period for claims ends. Unspent dependent care dollars and any amounts above $500 for healthcare or limited FSA will be forfeited per IRS requirements. This slide lists some of the eligible FSA expenses. You can also find a full listing on the IRS website. When considering if a healthcare FSA is right for you, looking back at your prior year out-of-pocket can be helpful. This slide covers eligible dependent care expenses. It is important to note that both you and your spouse must be working full-time or full-time students in order to qualify for participating in this plan. $5,000 is the IRS annual calendar limit per family, so only you or your spouse should enroll to this maximum. Miltenyi provides an employee assistance program, which you and your household members can access at no cost to you. Through the EAP, you have access to experienced master's degreed clinicians for consultation in person or over the phone. You are eligible for up to 3 visits per incident. You may also receive referrals to support groups, community resources, and wellness tools. Through the website listed here, you also have access to the Morneau Chappelle Perks platform, allowing you to register and earn points for shopping experiences, including flower orders, theater tickets, cruises, rental cars, restaurants, fitness, and more. The EAP program is available 24 hours a day, 7 days a week. Thank you for taking the time to review Miltenyi's benefits. Remember, November 25th is the deadline to make any changes or complete your FSA enrollment in UltiPro. All elections will become effective January 1st, 2019.